Patient concerns is something I thought might be a bit more of an issue when we first went down this path 6.5 years ago. It's been interesting to see that as this has rolled out, there's been a bit of interest in the more recent period with the opt-out phase of the My Health record. But generally, patients feel pretty comfortable that we've got access to their health records. They actually are quite surprised when you have discussions with them that we haven't had access to this information before, that we didn't have their date of birth. So this is sort of stuff that I was surprised about, that how accepting people were of the benefits around the My Health record. There have been some patients that have been funny about the concept of having a repository that had all their information. I've found that the conversations with patients have been around security and access, and so reassuring them that the security built around this system is very, very high level. And likewise with privacy around people getting access to the patient's information, reassuring them that it's not just typing in a name and address and pulling up someone's record. It's all audited, it's all traceable, and it requires 5 bits of patient information. So you can't just have a name and address. You need a Medicare card, you need a date of birth, and you need their gender. I can't look up my next door neighbour just because I want to. And if I did, it's all audited and it can be traced back to me, and you get slapped with a massive fine. The consent component of the legislation around My Health record is important for staff to understand, but also for the consumer to understand. They have the ability to change that consent at any time, so they don't have to withdraw from the My Health record completely. They can consent or not consent to something being uploaded. If the patient is within our care, so we're providing dispensing for them, or we're discussing their medication with them, or we're doing a medication review or a meds check with them, then we do have that consent given to us through the legislation. That doesn't change your obligation as a professional to discuss that with the patient. If you're dispensing certain medication that you may deem as slightly more sensitive, it would be nice just to let the patient know you're uploading this and they are happy with that. I am a very big believer in we upload everything because, and if patients are concerned, explain to them that the benefit of having the My Health record is having a complete data set that gives a really good idea of what patients are using. If you start excluding certain bits of information that people may feel like they've got a stigma associated with, I think we're just reinforcing the stigma for the patient, and we're also decreasing the ability to give them that complete care. There is some things that we need to be aware of, that different states do have different rules around certain privacy, and people should check in their own jurisdiction with their state and territory as to what rules apply. If a patient does choose not to, they can certainly choose to ask to withdraw consent for that upload for that particular dispensing, and that's easily managed in the dispensing software. So handling sensitive medication uploads is one of those areas that I think as a profession and us as a business and me individually is still sort of working through how best to handle that. I really don't like the idea of stigmatising patient medication. I'm also very conscious of an individual's choice and how they may deem their medication and may want to have different levels of uploads for their medication. So the beauty of pharmacy is a lot of our patients are regulars, we do know them, and we can have that conversation around this information. Do you want it to go to your My Health record? And it's easy to control that at the time of dispensing. So it's good practice just to engage with the patient and let them know that this information is starting to go through their My Health record, because a lot of patients aren't aware that the My Health record is actually on and that they've got one, even despite all the marketing around the opt-out period. So a lot of lack of awareness. So it's just good practice to engage with the patients and have that conversation. There's a huge amount of benefit in the My Health record. It's absolutely critical for patient care to have that information. The more information we have about a patient, the better we can care for them, the more we can help them manage their health issues. My Health record is not a complete record. It doesn't replace clinical judgment. It doesn't replace patients actually providing as much information to their clinician at the time, whether it be a doctor, a pharmacist, a nurse. They need to also disclose everything, because the My Health record may not pick up stuff. The computer may not have uploaded certain things. It might have been a dispense technician who wasn't it doesn't have an APRA number, so then they've not uploaded that information for dispensing. So there will be data gaps. It's not a complete record, it's not meant to be, but what it's trying to do is bring together lots of data points, lots of dots, and the more dots you have in a picture, the better the picture becomes. So it's critical that patients get as much information in there as possible, and I'd encourage all pharmacies to actually be onboarded with the My Health record, regardless of your individual choice to have a record or not. The business and the pharmacy's obligation is to allow that service to their patients to give that more complete care. If a patient goes into an ambulance and the ambos are there and they're trying to decide what medication to give, what allergies they might have, if they've got a latex allergy, they will have that information on their record and may reduce the chance of having an adverse reaction on the way to hospital. Same thing in the hospital. So these are critical bits of information that I think people don't think about until they're in trouble and then go, oh gee, I wish I had that. So building that data now and building people's records is a critical health strategy and will help people going forward in the future. The big issues we've had with the My Health record rollout is the lack of awareness of how this is the patient's health record. It's their health record, My Health record. People haven't really grasped the fact that they have complete control of their record. They can set all sorts of permissions. So in their MyGov login, once they're into the My Health record, they can set PIN codes that they can provide to their individual providers, so no one else can access it unless they've got a PIN code. So that really narrows down the number of people who can even access their record, even if they had all the information about that patient. It allows for SMS alerts and email alerts if someone accesses a patient record. So there's a lot of controls a patient can put on that. They can block out certain areas of their My Health record so that access can't be granted. And if they so choose, they can delete at any point their record. And it is a hard delete. So that record will be completely deleted and not just archived. If a patient contemplates doing a hard delete, I'd be really encouraging them to think about that, because a hard delete means a hard delete. It's gone. It's not going to get information historically back if they decide to opt in again. But again, this is the beauty of the flexibility of this system. Patients could hard delete and then decide tomorrow, oh, actually, I want a My Health record again, and they can opt in again. Importantly as well, reassuring your patients that not only do they have the control, but there are systems within our pharmacies that make sure that we're observing their privacy and confidentiality, and that security in our business is really robust, and that we're not allowing people to access the data. We're not allowing any insurance companies getting data, employers getting data. These are some of the fears that patients have, and it's really important to understand that they are real fears, and patients may genuinely have concerns about that. But if we have good policies and we can build that trust with our patients, I haven't seen any issues in our pharmacy. Over the last few years, we've had some really good use of the My Health record, where we've had people come from interstate that might have had a record in their state, and they've been using that record and there's been data. And I had that exact example where I had a person come from Queensland on holidays and they'd left medication behind, couldn't remember what strength of medication it was. I could go into the My Health record and there it was. So it was easy for me to then give them continued supply and sort out scripts and things like that later. So that was a really tangible benefit of having that record. Another good example is a patient new to our pharmacy, ran in, dropped the script, pharmacy assistant got the details, and then they ran off to the supermarket. It was new medication from our point of view, because we'd never seen the patient before. We had no record. When we set her up in our dispense software, identified that she had a My Health record, and that then allowed us to go in and see that she had actually had this medication previously. That then changes the conversation when the patient comes back on the counselling. Rather than saying, oh, Mrs. Bloggs, have you had this before? Is Mrs. Bloggs, how are you going with this medication? Have you had any side effects? Are your therapeutic outcomes, goals being met? And so you're changing your conversation. We only have a couple of minutes with patients most of the time, and half the time they don't remember what we say anyway. So making sure it's a targeted conversation can only help patients benefit from our expertise, rather than us wasting time on information they already know. And by using the My Health record, even for a patient we'd never seen before, I was able to really channel and hone in on what was important to that patient.